Hello everyone, it's my honor to introduce our work on developing the vessel wall imaging of intracranial perforating arteries with 0.3 mm isotropic resolution at 70. I am Zhang from the Institute of Biophysics, Chinese Academy of Sciences, Beijing, China. To begin with my talk, let's first look at the lenticulostriate artery. Lenticulostriate artery is a kind of cerebral small vessel that supplies blood to basal ganglia. Its impairment will cause lacunar infarction and the lesion of basal ganglia. But imaging LSA is very challenging because of its small caliber. It's only about 50 to 200 mm. According to previous studies, time of flight MR angiography at 70 was able to show its flow. However, clinicians hope to depict its vessel wall in a finer way. For the vessel wall imaging, 3D turbo spin echo is a broadly used technique because it provides higher signal-to-noise ratio that supports higher resolution imaging, and its isotropic work source inherently facilitates the multiplanar reconstruction. This right figure showed our previous study of using VWI at 3T to display the lumen of lenticulostriate arteries. In principle, 70 MRI provides higher SNR and can potentially improve the resolution. These images with the isotropic 0.4 mm resolution in 10-minute scanning proved that VWI at 70 can barely show the vessel wall of lenticulostriate arteries, but further pushing the resolution will greatly increase the acquisition matrix, which leads to unacceptable acquisition time on patients. So, in this study, our purpose is to develop the in-volume 3D TSE sequence for the vessel wall imaging of lenticulostriate arteries. We hope to achieve isotropic 0.3 mm resolution in 10 minutes. For this purpose, we need to improve the resolution while limiting the acquisition matrix. Therefore, we designed an in-volume excitation covering the LSA territory only, as the right figure shows. The 3D TSE sequence was named Space in Siemens scanner, which was composed of the excitation pulse, the variable refocusing flip angle trains, and the magnetization restore module. Here, the excitation pulse was replaced by our customized 2D RF pulse for in-volume excitation. In the pulse design, we adopted a spiral-in transmit K-space trajectory. To overcome the field inhomogeneity in ultra-high field, the B1 and B0 maps were incorporated to the pulse design with the phase constraint of CPMG condition. In the experiment, the B1 and B0 maps were firstly acquired. Combined with the predefined excitation pattern and the K-space trajectory, the F pulse was optimized and compiled to the space sequence. Here are our results. The performance of the optimized design was compared to the conventional 2D F pulse. By incorporating the B1 and B0 inhomogeneities, better background suppression is achieved by the optimized pulse. The better performance also greatly alleviated the aliasing artifacts in the reduced FOV acquisition, as the right figures show. To analyze the performance of displaying LSA, we manually draw the center line of MCA and build the curved MPR. In the right figures, we show the superiority of using 0.3 mm isotropic resolution in IV space. Because of the small acquisition matrix, the K-space center was oversampled so that higher SNR can be achieved. It guaranteed more smooth and continuous delineation of LSA. The visible length of LSA in IV space is also longer than the conventional space. Finally, when analyzing the section of vessel wall, IV space exhibited higher contrast in showing the wall and the lumen of the LSA. It benefits the identification of LSA in brain parenchyma. So, in conclusion, in this study, we developed the IV space sequence and demonstrate its superiority in displaying the wall and the lumen of LSA. In the future, the workflow for field maps acquisition and pulse design will be optimized for fast scan on patients. On the other hand, the clinician implication of this technique on small vessel disease will also be explored. This work was supported by a grant from the Ministry of Science and Technology of China, Beijing Natural Science Foundation, and National Natural Science Foundation of China. This is my presentation. Thanks for your attention. If you have any problem, please contact my email.